morning, everyone. I'm Anna Larson, Spouse Link Ambassador. I am so excited to be here with you today. Today, we are going to be talking about healthcare and military retirement and transition. So, when you're transitioning or retiring out of active duty, you have to make a decision on healthcare for your family. And if you're transitioning, you have to know what you qualify for, how long does it last before you need to be able to find civilian or employer health care to take over from what was previously offered to you by your active duty status. And if you're retiring, you need to know what program options are available through Tricare, what you have to be aware of when you're trying to register and enroll for those, as well as the steps that it takes to get through that process. So this is Tricare 101 for retiring and transitioning military families. We are not going to dig deep into the very specific specialized questions today. We're really going to kind of try and give you the what you need to know aspects of Tricare when you are going to be transitioning or retiring, so you have a smoother transition and a smoother retirement. So first of all, thank you for joining me on this Spouse Link live stream. I'd love to hear where you're joining us from. As I mentioned before, I'm Anna Larson, and I am the Spouse Link Ambassador for retiring and transitioning military families. And this all came about because a year ago, my spouse and my family retired after more than 20 years of active duty service. And our transition did not go smoothly. And there's a lot of factors that played into that. But that just put a burning fire passion inside me that said, okay, there's got to be a better way. There's conversations that I wish that I had been part of. There's things that we need to be talking about so that this transition process happens more smoothly for families that come and military spouses and service members that come behind me. So without going too deep into this, I'm going to introduce our guest because bringing her on is going to be super fun. If you don't know, well, let me pull this up really quick. I'm going to pull up this. Oh, I'm going to make it bigger though, just like that. All right. So pulling over here. So Sarah Bumgardner, she has been a guest with me before. And Sarah is amazing. She is the member coordinators for AFMA. And so let me just tell you a little bit about her. First of all, Sarah was a military spouse for 11 years. She had previously served with AFMA as a senior veteran affairs coordinator in Western Virginia. And then she was also the Spouse Link ambassador, very similar to what I do in the Camp Lejeune area, and then a relationship manager for the AFMA Wealth Management and Trust. But before she joined AFMA, she was admissions coordinator and medical records supervisor at a skilled nursing facility in 29 Palms, California. Sarah's the mother of 2 boys. She loves spending time outdoors and helping others. She graduated from Auburn University with a health and hospital administration degree and a minor in business. And she loves first and foremost helping people. And I'm just going to tell you that's so true because Sarah is amazing. And that's why she's here today, is to help us better understand Tricare and the process. So, hi, Sarah.
Hi, Hannah. I'm so glad to be back on with you and talking today.
I know.
It's been too long. So
I know. We've got so many people on here. I just want to say hi to everyone. We got Lynn from Virginia and Amy from Fort Hood. Hi, Amy. We're like neighbors. I'm in Fort Hood too. We've got Brianna that's in Austin. We've got Jared jumping in to say hi. So many people, because you want to know why? Sarah, this is the hottest topic that goes on in the military retirement community. Truly.
it is. It's a hot topic. And that's what we're gonna try today to break it down, right? In some sort of piece that we can all digest and understand when we're going through this transition. What do I need to do with my healthcare? Because that is such a huge question. And what does my family need to do? How's this going to affect them? So hopefully we can answer some of those questions today and make sure people feel ready and prepared and educated to do this.
Exactly. And just to start off with everyone, we want to make sure that you know that your situation is always going to be different from everyone else's situation. The answer for the Anna Larson family is going to be different than the answer for the Sarah Bumgardner family, right?
Yeah.
And that's because our healthcare needs are so specific to us. And honestly, sometimes it feels like every military base you retire out of is going to tell you something different. Mm-hmm. And every Tricare person you talk to might tell you something different. And so it really is going to be, this is like the what you need to know, where a good place to start from, but you have to dig in on your own
Mhm.
and I mean, just put it plainly, right? Take responsibility for getting those answers specifically for you. Yeah.
Absolutely. Yeah,
Yeah.
absolutely. And there's some, really big things we're going to talk about. Timelines, timing is really important. Understanding the difference between the different plans and things. So we'll get kind of into that and dive into that. But you're so right. Everybody, when it comes to healthcare, is different, and where you live determines what healthcare you're, accessible to. So
Yeah.
we're all unique.
Yeah. We have a couple of comments here. This one, I 100% agree, Jared. A planning problem from the earliest days in service. It really and truly is like understanding your healthcare, what you have, and then what's going to happen as you move forward, because not everybody retires, right? We have families that are transitioning out and it's different for them. In fact, that kind of brings us to our very first question. So, you ready to jump right in, Sarah?
I'm ready. Let's do
Okay.
it.
Okay. So our question number one is, what happens to service members and their families' health care when they transition, not retire, from
Right.
active duty service?
Yes. So I went through this myself, right? Only being a military spouse for 11 years, transitioned out. And there is a program, you're not left on your own accord. So know that there is something there. It's the Transition Assistant Management Program, TAMP. And it's there for you. It will give you 180 days of healthcare benefits, just like your regular Tricare benefits, to cover that cost. So it's almost 6 months of healthcare that you're going to be able to have. And this is to help make that transition to the civilian world. Maybe you haven't quite gotten a job that has healthcare, or you're still trying to look at how to purchase that in the marketplace or what's right for you and your family. But know if you're transitioning, meaning you're separating from the service, no retirement, that there is still coverage for you. It's under TAMP. And through this TAMP, I'm going to touch base on just a couple of highlights of that TAMP program. Again, it's 180 days from when you separate. So a lot of times people think when they go on terminal leave and they're not coming into the office every day, that's when they're done with their service. It's what's on your DD 214. So that last date of service on your DD 214 is your separation date. And that's when your TAMP begins. Because when you're under terminal leave, you're still covered under your regular Tricare. Everything is still just regular, the same. So that's important to know. And it's really important because terminal leave can be a great time for you and your whole family to get all those healthcare things wrapped up, right? Get all of your last physical in, get a last, check on this, get that all kind of wrapped up in a nice little bow so that when you are under this transition program, you're not having to do all of that. So that's a good kind of little tidbit. Again, it's of no cost, so it doesn't cost anything to be under the TAMP program. You still get dental and vision care. As we know, for family members, dental and vision is a bit different, right? We have to have a dental program or plan. They are still able to receive that care. As an active duty service member transitioning out, you can still receive care on a military installation for your vision and your dental. It is based, of course, off of their availability and your priority in that. And then same thing for vision. Your family, if they've had that vision plan, they will still have that. And you can get a routine eye exam. I think it's every 2 years. So if your family needs that, again, just get all of that taken care of when you're in terminal leave. But know that the Transition Assistant Management Program is there. It's there to kind of give you that buffer, a little bit of peace of mind. I think it's a great peace of mind
Yeah.
to transition over. So.
It absolutely is. And this is something I think that people get really nervous about, right? With that transition out of the military, because if you don't have a job lined up, then it's, what are we going to do for healthcare, And so this is an incredible benefit that's available. And it's completely different than your Tricare that you're looking at when you're retiring. So any of that stuff that you read about Tricare retiring does not apply to transitioning service members. It is 100% this TAMP program. Now, this, just to kind of also jump back, I have thrown a link into all the different areas that we are streaming today. And so you'll see these links that I've popped in there. This is going to be a very link heavy live stream. I'm going to throw information links at you all day long. But if you're transitioning, not retiring, that TAMP is going to be really important. So Jared just asked about TAMP applying to the retiree community. It does not. This is only for transitioning service members that have not retired with that 20 years of service and are not eligible for continued Tricare access.
Yeah, they're absolutely correct. So this is you're separating from service, which means you're not retiring, you're not in that eligible category to continue actual Tricare. This just gives you a buffer. It's a little buffer. And that's a great question because that can get very confusing, right? What program do I fall into? And there was another person on here who had mentioned that, usually civilian job benefits might not kick in for 30 or 60 days, right? Yeah. Great thing to put out there because you're right. And so this can cover you. This will cover you for those who are not retiring again.
Yeah. But it's also a good planning purpose. So if you know you're not starting your job for 60 days and your healthcare doesn't kick in for another 60 days, you have to look at that 30 days of no healthcare options available to you. What are you going to do during that 30 days of where TAMP ends and your new employment healthcare kicks in? So for planning purposes, just be really thoughtful if you're separating and transitioning from the military. If you're there's so many different terms for it, right? We call it transition or separating and not retiring.
Right.
I hope that's clear as mud for everybody that's listening, right?
Yeah. But I love that you said thoughtful. I think that's a really key word to keep in mind throughout this entire discussion we're going to have about Tricare is that you have to be thoughtful in how you're approaching this and plan. So
yeah, exactly. Okay, so Sarah, unfortunately, that's really all there is to talk about for the people that are separating from the military and not retiring.
Yeah.
Because Tricare is done after that 180 days. It's not really an option for you to continue on with it if you're no longer part of the active duty service.
Mm-hmm.
So we're going to jump into the retiree category.
Yeah.
And let's talk about what options are available through Tricare when you retire.
Yes. So this is what we're going to kind of get into the nitty gritty of. The good news is you get to keep your health care. You get to keep Tricare. Yay, right? It's a great program. That's the good news. A little bit of bad news is it's going to cost you a little bit more to do that. And you are going to have to enroll in this program. So like we talked about before, we need to plan for and we need to be thoughtful in making that decision. So when we talk about Tricare for retirees, you have to enroll into a program, either Tricare Prime or Select, and we're going to get into that in a minute, but you have to do that within 90 days after your retirement date. And remember, again, when you're on terminal leave, you are still under your regular Tricare benefits. It is based off your DD-214 date. So don't forget about that. Sometimes people forget, they go on terminal leave and they think, okay, that's it. I'm retired now. Yes, but also know that date on your DD-214 is very important because within 90 days, you need to get onto the Tricare website, you can call Tricare, and you need to enroll into Tricare now. And you need to start your Tricare journey over.
And I think it's important to note too that enrollment is based on your DEERS eligibility.
Yes.
And so if you kind of have to wait until your DD-214 is in your hand in order to make that into the next category for Tricare retiree status.
Yes. And that's because you need to get a new ID, right? We need to get a new ID card, and that ID card is linked to DEERS, and Tricare uses DEERS information. Right. So Tricare goes in and they say, well, if DEERS tells us you are this, then this is what you are eligible for. It's very cut and dry. So that's why you need to wait until that DD-214 is in your hand. You've got the date, and then you have 90 days. Should you miss that 90 days, hopefully you do not. You have heard what I'm saying. Don't miss it. You do have up to 12 months. But you're going to have to do work on that. You're going to have to go in retroactively. You're going to have to put in any claims, on your own to submit to them. And it gets muddy. It gets complicated. The point is just do it. Do it within that 3-month window. When you get your new ID, your retired ID card, do it right then. Get the card, call them. Just do it right then.
Yeah. So we have a couple of questions that are coming in. I want to pull up Tyrone's first. So TSM, I'm assuming that's transitioning service member.
Okay.
Tyrone, just to clarify, TAMP is only available for the service members that are not retiring, but transitioning out before that 20-year mark.
Mm-hmm. Yes. And that would include too, somebody who might be medically retiring from service right before that 20-year mark. They're considered retired as well. So these are just veterans who are separating from service and not in a retirement status of any kind.
Yeah. Perfect. And then Brianna asked, medical, dental, and vision are all different from enrollment. So medical is going to be your Tricare enrollment. Dental and vision are completely separate. And we are going to get to that in just a little bit. So we will touch back on this one, Brianna. And then Jared says my last comment confused him. So I'm thinking that the last comment that we were talking about is that getting your ID card and everything's updated through DEERS. Mm-hmm. So you can't, a year before you retire, you can't sign up for your Tricare benefits is basically what I'm saying. Yeah. Unfortunately, that process, even if you want to plan in advance and get it done in advance, that process has to happen with the timeline that you're allowed to do as you go through the retirement process. So Tricare is going to enroll you into the new retiree, Tricare Prime or Select option once your DEERS is updated to reflect that you are a Tricare retiree or Prime or Select eligible person.
Yep.
I hope that cleared it up.
Yeah, you're spot on there. Yeah, just as much as we want to plan in advance and like do this a month before you go on transitional leave or something, we have to wait. So you just have to wait to get that updated. So.
Yeah, and I will say this as well. And says Jared, you do ask another very good question. The wait time for IDs now is months and 90 days. So the answer to that is my service member was able to get an ID card right away. I had to wait 6 months. But my status in DEERS had been updated.
Yes.
Unfortunately, what that 6-month wait did, and that was 6 months after retirement, but what that 6-month wait did is it made me ineligible to use any of our military healthcare options. Like if I had a referral during that 90-day time or something like that, I couldn't go in and use it because my ID card as an active duty spouse was no longer valid. So again, another thing to just take into consideration in that timeline, those last 60 to 90 days before retirement are crazy with all the things that you have to really think about. Mm-hmm. And that ID card is a big one because if you're still planning on utilizing or accessing any services on post, including healthcare, during that 90-day window you still have after your retirement DD 214 is in hand. If you don't have the right ID card, you still cannot access that healthcare.
Yeah. And it's all tied to that DEERS. And you make such a great point too, that when we're starting this retirement journey through this process, and we start this healthcare kind of journey of transferring everything over, when you get signed up into your new Tricare enrollment for retirees, whether you select Prime or you select Tricare Select, you are starting that journey over. So you have to get reestablished with a primary care physician. You have to get new referrals for specialty care. So, just plan for that's going to take time. And you have to kind of start this journey over. Once you get reestablished with everything, then it will be smooth sailing, but it's going to be a little bumpy in the beginning.
It is, and frustrating and time consuming. I mean, I'm not going to mince words here. It can be very frustrating to call all the different doctors' offices and asking them, do you take this? Do you take that? Redoing all of your referrals if you have specialty care. Everything gets redone. You might still go see the exact same specialist You
Mhm.
might not. I mean, that's not, depending on if you're moving or staying or, what's happening in your life other than that. So,
Yeah.
but just get prepared for that part of it. This is why, and this is partly why TRICARE and healthcare is such a huge conversation with the retiring community, because people don't know, and then they fall behind, and then they are frantic
Yes.
because healthcare is so important, right? I mean, you can't just let it go for 3 months if you need something, right? That's not your best practice. So hopefully this conversation helps, right?
Yeah.
Okay, so we're going to move on and talk about
Mhm.
just some of the benefits and costs associated with the TRICARE options. I'm going
Mhm.
to pull up this slide here, Sarah, so you can refer to it,
Yeah.
and
So
we'll go through this.
yeah, so let's just kind of get into this. And again, you want to do your due diligence. You want to do what's right for your family and for your healthcare needs. But when we talk about TRICARE for retirees, there are two things that you have to decide. And when you call them to say, I want to enroll, I'm retiring and I'm in my 90 days and I want to enroll in TRICARE, you have to make a decision. You can choose TRICARE Prime, or you can choose TRICARE Select Group A. Group A means you've joined the service before January 1st of 2018. And so most retirees are going to fall in that category. So TRICARE Prime is very similar to when you are on active duty. You're going to a military installation. You have a primary care provider who's then going to refer you. You can see that there's an enrollment fee, right? There's an annual enrollment fee. It is working similar now to the civilian world. So civilian healthcare, right? We have enrollment fees, we have deductibles, we have co-pays and cost shares. And so that's what we're talking about in this now. And so under TRICARE Prime, we have that enrollment fee. We have a deductible. We have, outpatient visit fee if you're going to have to go outside of that military installation. And so that's what TRICARE Prime is. It's working very similar to what you have known. And that's kind of what your family would fall into. TRICARE Select is a lot more similar to what the civilian population has when it comes to healthcare, where we now have a cost share. So if it's in network, you're going to pay less than if it's out of network on that cost share. And I know kind of in our next segment here, so hang with me, everyone, before jumping in questions on that cost share. Our next question is going to be talking about that cost share and where you can look at that. So again, the enrollment fee for Select is a bit different. Okay, it's a little bit, a different cost, but that's because you now can pick any primary care provider you would like to go to. You do not have to have a referral to see a specialist. You think that you have a hearing problem, you go to the audiologist. You think that you have something wrong with your elbow, you can go to an orthopedic directly. But you're going to have to pay a cost share on that. So that's where you live and where you choose to live can make a really big difference, right? If you're living in, say, the DC area and you're near all these military installations and all these posts that have military hospitals, can be very easy to get healthcare on there through TRICARE Prime. If you're maybe in a remote location in Ohio or Oklahoma and there isn't a military base near you, TRICARE Select might be your better option. Now, I would encourage everybody to call. So if you want to seek care from a provider, you've been going to the same doctor who happens to be, for some reason is off base or off post, you can call them and say, do you take TRICARE Prime? Are you considered an in-network provider of Prime? Do you take TRICARE Select? Are you in-network with Select? So you have to do your due diligence. You have to call around, call those providers and see, do they accept that benefit? Do they accept that TRICARE? And depending on which one you want to pick.
Yeah. I want to throw out here also, like the TRICARE Prime option. Even if you are near a military base, once you hit retiree status, you are not assured a spot in the military treatment facilities that are near you. You're kind of like, when we have space available, you may utilize our services.
Yes.
Otherwise, you're paying Prime, but you're still getting select care in that sense. You do have to find an off-post doctor that's willing to take TRICARE Prime insurance to
Yep.
service you if you cannot be seen by your MTF. Okay, so that is a real possibility, because when there's an influx of service members and families, retirees are no longer going to have space available to them in order to access that medical care.
Such a great point, Anna. I'm so glad that you mentioned that, because that should be another one of your considerations, right, in determining what you're going to enroll in. And sometimes, there are providers, they'll take Tricare Prime. It's not a problem. You just have to call. You just have to do your due diligence, right?
Yeah, exactly.
So.
So we do have a question from Brianna about what changes depending on what you're electing for Prime or Select based on the area you live or move to. And I think, Brianna, this next slide and this next conversation is going to help you better understand a little bit about what options there are based on that. So I'm going to pull this up, and I know you can't really see the numbers here, so I'm going to post right now in the comments a link for this website here that goes over the copay and cost share information for Prime and Tricare Select A. And then I'm going to let Sarah take it away and have a conversation about this for a minute.
Yeah. So this is this chart's great. I would encourage everybody, go to this link. It's mapped out very simply. It will let you know and it's a percentage. And the reason why it's a percentage is because if I receive care, say in New York City, it's probably going to cost me more than if I receive care in a very small town in Montana. Right? So that's why it's a percentage of care. So I wish that I could tell you what that is. I wish I could tell you what the cost of it is, but it is determined on the provider. So that's why you want to look at where you're going to be living, right? And what you think would fit for your family and what the cost of varying care is. And then this chart can show you what percentage you would be paying. I do want to make a note. I actually had a service member when I was doing a Soldier for Life ask about catastrophic events. What happens if something really terrible and awful happens and you have a catastrophic event? Something to note that Tricare Prime and Select both have is they have a $3,000 cap. Being somebody who's now in the civilian world and has health insurance in the civilian world, let me tell you, that doesn't exist anywhere. So if something really terrible should happen and you have a catastrophic event and you are in the hospital for 2 weeks and you are running up hundreds of thousands of dollars in bills, both Tricare, Prime, and Select will cap at $3,000. And that is a huge financial benefit there. So as you look kind of as these cost shares and the copays, and that was a question because I kind of got a little worried. Well, what happens if I have this huge event and I have, $1 million in medical bills? You're only going to pay $3,000. So that's just something to kind of sidebar note about that I like to mention because that's a really big benefit. But hopefully I answered your question. Even though it might be vague that you have to look at where you're going to be living. But this graph will help in understanding that. It'll help understand what percentages.
Yeah. And again, I've thrown that in all the different places. So it's on LinkedIn, YouTube, and on Facebook under the Spouse Link organization, and on my LinkedIn page that really does show those. It's if you just go to that link and take a look at it, I was not given that link until Sarah and I talked over this past couple of weeks. So it is super helpful and very beneficial as far as just helping kind of give you an idea of what kind of payments you should be planning on based on, your medical style, right? So if you're at the doctor every week versus if you're at the doctor once per year, right? And then for your kids and family and spouse as well.
Yeah.
Okay. So our next question, we are moving from the Tricare Select into what happens when you become way more seasoned and all that white hair starts to grow in and that retirement beard is now, down to the, your belly button kind of thing. What happens with Tricare when it becomes Tricare for life.
Yes, this is very important. Even though that might be years from now, it is important to understand as a retiree what happens when you turn 65. It's a magic number. 65 is a big number for our military retirees. So you move to Tricare for life. However, you basically drop from Tricare completely. Unless you select and enroll in Medicare Part B, you will lose Tricare completely. And there's no wiggle room on that. So it is done through Social Security Administration office 3 months before. Now, this is something you actually can plan for ahead of time. 3 months before you turn age 65. And I would encourage everyone to do it exactly 3 months because it can take a couple months to get established. You go through the Social Security Administration office, you enroll in Medicare Part B, and the second that you do that, your Tricare then becomes Tricare for life. So your Medicare Part B will now pay first, and you will have Tricare as secondary. And if you don't do that, you will lose Tricare completely. So 3 months before 65, sign up for Medicare Part B, and you will seamlessly transition over to Tricare for life. And be enrolled in that.
So Lynn's comment just made me laugh because yes, Lynn, I know I had the exact same reaction when I heard about this. I'm sorry about that. I did not mute. I apologize. But I had the exact same reaction when I heard about this about a month and a half ago. I had no idea that this happened at age 65. I had no idea that Medicare came into play anywhere in my Tricare world ever at all. So this is something that I felt was really important to add here because it is something you have to plan for.
Mhm.
Your co-pays, your annual cost for healthcare is going to change. And like
Yes.
Sarah was saying, it's based on your Social Security, it's based on your income. So if you're still working, that's going to factor into how much you pay per month.
Yes.
It's I mean, there are all kinds of little things that you're going to need to be looking at. And the person who told me about it, their healthcare costs had almost tripled when
Yeah.
they hit age 65 because of some of the income factors that they were looking at. So if you are thinking that your Tricare that you sign up for right at retirement is the Tricare you're going to have for life, that is not the case.
No. And yeah, and you're so right. So that because now this is under Medicare and Medicare is going to pay first and Tricare is going to pay second, you are going to start paying your premium will be your Medicare Part B premium. So you no longer pay a premium to Tricare. There's no premium for Tricare anymore. It's a Medicare Part B premium. And that is based off of your Social Security amount, your income. If you're currently still working at age 65, a lot of people are, what that income looks like, what your Social Security, if you're drawing it. So it's based off of income. The standard or average is about $70 a month in a premium. So it absolutely will increase, just even on a basic level. So just, prepare for that. Something that also people ask is they say, well, what happens if I turn 65 as the sponsor, but say my spouse is not yet 65? What happens to them? Don't worry. So your spouse will be carved out. They'll be under whatever Tricare Prime or Select you have made. They will continue to pay that enrollment fee. And you now will have to enroll into the Medicare Part B, and you'll be in Tricare for life. So you'll have two. So the spouse isn't going to lose anything, or the child's not going to lose any coverage. You're just carved out now when you turn 65. But then the same thing happens for the spouse. When the spouse is getting ready to turn 65, same thing. 3 months beforehand, enroll in Part B. So
Yeah. Exactly. So Brianna threw up a question. Tricare for life, only for 65 and older. I was told medically retired was eligible. So Brianna, I did take a look at the medical retirement website under Tricare. And what they say is if you become eligible for Medicare under age 65 for a disability or any other reason, you have to have Medicare Part B to keep your Tricare. So prior to that, it just refers to medically retired getting Tricare benefits the same as you would normally under Prime or Select. And again, I apologize. I don't know what. apparently I'm very popular today. People keep trying to call me and
Love that.
no, no. Anyway, so that is what it's saying. And I'm going to, just for your benefit, I'm going to throw that link to that just into the comments so that you have it, so you can just investigate a little bit more about what that does offer. And then I also wanted to throw up this comment from Lynn, because I think this is very important also to note that if you hit this Medicare, and you have to make sure your doctors are going to actually take this new healthcare insurance you have.
Yes. Yep. And just like anything, just like when you are transitioning right from the service and you're getting your new Tricare enrollment and you're kind of starting over, right? We're starting over that process. We're getting we're establishing with new physicians and getting our specialty care set back up. Same thing happens when you now move to Medicare Part B. You need to check with your physicians ahead of time and make sure that they accept Medicare Part B and that they'll accept Tricare for Life as a secondary. And then, if for some reason they don't, then you're going to need to switch providers. So it's just one of those things where, unfortunately, we're not quite done, right? We think when we get to retirement and we do all of this and we're done and we're out of the uniform, that's it. And unfortunately, it's just not the case.
Yeah. We had another question pop up from Michael. The service member get coverage from the VA, but family members cannot get treatment from the VA. And that is correct.
Yeah, that's right. So Department of Veterans Affairs is for the service members. One thing to note here too, when we're talking about this, is if you are retiring and you have put in a VA disability claim, that any condition you are service connected for is treatable through the Department of Veterans Affairs, through a VA medical center. That also applies for our service members that are just transitioning. So if you're just transitioning and you have no eligibility for Tricare outside of TAMP, anything that you are service connected for, you can seek care for at a VA facility. And please know that, and please use that resource and utilize that, because that's really important. They're there to take care of an injury that has incurred while you were in service and serving. And so that's of no cost to you. So that's also kind of another place to be able to get healthcare.
Yeah. Thank you so much, Sarah. And then just so everyone knows, I did go ahead and throw up the medical retirement link. So if that is something that you're looking at or facing in the next little while, then this is going to be the link where you're going to want to go and get some more information about that.
Yeah.
Okay. So we hit on transitioning or separating service members. We've touched on Tricare Prime and Select Group A and the cost and co-pays that have gone along with it. Mm-hmm. We just talked about the Tricare for Life and Medicare combination that happens at age 65. So now we're going to jump into one more category that I think is important for all of transitioning and retiring service members to know about, which is Tricare options for your kids, your young adults, and what happens as your kids get a little bit older and they need, what's available and how long does it last?
Yeah, so Tricare Young Adult is an option. It's a great and cost-effective option. Tricare, so what this means is that Tricare will continue to provide insurance for your child or that young adult up to age 21. Or age 23 if enrolled in college. And you, as the service member, has to show that you are paying at least 50% of the child's finances and supporting them while they are enrolled in college. And so they can continue under Tricare for young adult. Now, what happens though, maybe at graduation or turning 23, sometimes it takes people longer to get through school. Well, you can still have coverage after turning 23 or graduating from college, but you're not yet 26. You can qualify to purchase Tricare Young Adult on their own or under the Continued Healthcare Benefit Program. So there's two things there that can still cover the child, and it's a bridge. It's to give you a bridge, similar to that TAMP. It's to give you a bridge in coverage when you're going from being, cared for under Tricare to a civilian provider. And this is great. This graphic up here is showing you what is eligibility, right? You can't be an active duty service member yourself, right? You can't be eligible for Tricare on your own. You can't be married. Kind of those things to enroll for Tricare for young adults. So
Yeah. And I'm gonna, again, like we mentioned earlier, this is a very link heavy
yes.
live stream for all of you.
Yeah.
So I am throwing the information right now into the live stream that does have the information for TRICARE for young adults, as well as the continued health care benefit program.
Yeah. And that continued healthcare benefit, it gives you a temporary 18 to 36 month coverage, that gap between military and civilian healthcare. And this is a link heavy live stream because it's so important. Everybody's needs are different and everybody's situation is different. And so I'm hope that what this is doing is it's sparking kind of questions that you're thinking about, things that you're writing down to go, I need to research this more for my family. And where do I go to do that?
Yes.
And some of these links, as you said, Anna, they're kind of buried and hidden within TRICARE. So, having them at your fingertips can kind of cut out that search time a bit.
Yeah, exactly. The other thing I would just note there is it's going to give you some basic information, but I highly recommend just making that phone call and confirming what you think you know or what you think you understand and how it directly applies to your child's situation, your family's situation. Because you might, there might be little caveats that they're not putting on their website that you need to be aware of that would directly apply to you. And I know as military families, we have all run into that at some point or another. That should not be anything new. It is kind of like that plan A through Z, as you get prepared to make these kinds of transitions. So, okay. So the very last category that we do want to talk about, I'm just going to move this over. Let's talk about dental and vision options because they are not TRICARE.
Nope.
It's something totally different.
Yeah.
So we want to make sure that everybody is aware of what dental and vision, where you can access those plans, and what it is that's going to be available to you.
Yes. So this is not TRICARE, but is a benefit that military retirees are eligible to purchase, right? That's what gives you this eligibility to purchase. FedVIP is being a military retiree, and it's dental and vision plans. So they are separate. I wish that I could tell you what that cost would be, but I cannot. I wish I could tell you what plan you would even fall into, but I cannot. So the way that this works is you have, it's 12, there's 12 dental plans and 5 vision plans. And what you want to do is you want to go to this website and you want to put in your zip code. And based off of your zip code, it will tell you out of these 12 dental and 5 vision plans, which ones you are eligible for. So in your area, what you can choose from and the cost of them. And then from there, you have to make a decision as to which of the plans you want to pick. Call the dentist, right? Call your ophthalmologist, optometrist, say, do you take this plan? And then go from there. So that's how this works. And it's pretty simple. It's really cut and dry. You put in your zip code and it'll tell you have an option of these 4 plans. 4 out of these 12, these are them. Out of the vision, these are your 2 options. So, go in, but it's very, I think it's affordable considering from kind of civilian healthcare, it is more on the affordable range.
Yeah. So some of the things that as a recent retiree and one who has just gone through this, like discovering TRICARE and all of the dental and vision options and that kind of thing, couple things you're going to want to make sure you know about. You only have 60 days after retirement to choose a dental and vision plan. So there is that hard line of 60 days. And then after that, that's for that newly eligible for enrollment category right there that I have up here on the screen. That's 60 days after retirement. If you miss that, then you have to wait for open season. Yeah. Okay. And so, and that's very similar again to the way the civilian world works with healthcare. So open season happens once per year. So if you miss that, you will not have dental and vision options through benefits unless you can get it through some other way and just pay out of pocket for it. I'm sure, but
Mhm.
otherwise you have to wait for that open enrollment to be able to get into one of these dental and vision plan options.
Yeah. And also, if you find that you are in, say, a dental or vision plan and it's not covering what you are wanting, you are kind of stuck until open enrollment. But know that when open enrollment comes around, you can always change that. You can change to a different plan, or you can make a change during open enrollment. So
Yeah.
you're not stuck completely.
Yeah.
But yeah.
I am going to just throw in a little personal story here, right? So this is happening currently right now for my family, where my son is, we know he's going to need braces next year. And so we're looking at changing our dental plan starting in open enrollment this year so that we can cover his orthodontic needs next year, because we haven't needed those up until now. So it is a plan ahead and think about it in advance kind of situation where you do want to make sure that what's coming, that you're planning for it, because it's not just oh, we need something different, I'm just going to make a phone call and change that right now. That doesn't happen.
It doesn't happen. And there was a couple comments about qualifying life events. That is true. If for some reason you decided to go with maybe a civilian employer dental plan, and you were covered by that, and then you lost that job, that would be considered a qualifying life event. And then you would be eligible to sign up for the military provided dental and vision. So, there's also that option as well. And like we said earlier, kind of in the beginning of this segment and somebody made this comment, which I think is great, get your teeth fixed before you retire.
Yes.
I get everything fixed. That is what, when you're on, and we talked about when you're on terminal leave, as we mentioned, terminal leave, you are still covered under your regular Tricare benefits. You're not paying any cost for them. You're just cruising along like you always have been. So terminal leave can be a great time to get everybody in the family round up and get everybody to the doctor and get all of those things taken care of.
Yeah. And I would mention in here as well, if the VA does not cover dental care unless it is service connected. So your service member also needs to be looking at their dental care outside of paying for it, outside of what they think they're going to be receiving from the VA, unless they have service connected issues with their
teeth.
Yes.
Yeah. So dental and vision gets a little bit tricky. But we just have to plan for it like all things, and make the best decision that we can for our families. So, and hopefully that's what we've kind of done today and talked about, is get those wheels turning and thinking, and reach out and ask questions and start researching, and reach out to me if you have questions.
Yeah, and well, that's a perfect segue, Sarah, because we're going to go ahead and throw this up right here. Can you tell people how they can find you and the services that you offer?
Absolutely. So you can find on afma.com. We've got a great, learning hub tools where we have lots of information on there for service members, retiring, transitioning, new service members. You can reach me on LinkedIn. Feel free to find me on LinkedIn, or you can email me offline if you'd like at sbumgardner@afma.com. Drop me an email and I will try my best to help and assist in any way I can.
Yeah. And I'm just going to throw out there, this is the nicest lady ever. Like, she seriously, you ask a question, if she doesn't know the answer, she's going to find it for you, or she's going to find the link or the person that's going to be able to answer it for you. Yeah. So Sarah is a huge resource to have. So I highly, highly, highly recommend that you utilize her. If you are at this point in your transition, that you utilize Sarah for all the information that she can provide. And they support transitioning and retiring families in amazing ways. AFMA does. So that's my little plug for Sarah Baumgardner and all that she does for
Cool.
transitioning and retiring families.
Well, thank you, Anna. That's very kind, and I'm glad that you feel that way because that's what I try to do. So.
I definitely do. So we are at the end of our live stream for today. I just want to thank everyone for tuning in. Hopefully you got some benefit from this. Hopefully you got some information that you needed. And then also all of those links that we've thrown in there that are going to lead you to new places. I do want to say that I did drop on my LinkedIn page just this morning, I did drop the 2022 fees and costs for Tricare Prime and Tricare Select Group A. It's on a post right on my page today. It's a download PDF. I'm going to encourage you to go and get that and download it because it's gonna be a fantastic resource if you are looking at retiring any time over the next year. This is going to be a fantastic resource for you to utilize in terms of looking at what some of those costs might be. And I will, you just got to come find me on LinkedIn, connect with me on LinkedIn, connect with Sarah on LinkedIn. And then last but not least, SpouseLink, which is the one I don't even know what you would call it. They're the ones that are the event coordinators for these live streams that are happening for transitioning and retiring service members. So SpouseLink started the series to help military spouses that were struggling, like myself, we're struggling with knowing what retirement and transition was going to actually mean for their families. So their whole mission is to support, inform, and inspire. And we hope that we've done that for you today. Just want to say thank you for joining us. Sarah, thank you again. And we hope to see you on our next SpouseLink Live.
Yeah.